Welcome back. Here's the EMS and ED information you looked over, and here's a brief patient summary. It is nice to have a short summary of the patient's case. Important issues to include, if possible, are the patient's age, gender, and detailed mechanism of injury, and the time the injury occurred. Any significant past medical history and medication use can be very helpful, as in this patient's case. Known and suspected injuries should be listed. A brief overview of the care of the patient received helps to set the stage for the performance improvement information to follow when doing tertiary review. Let's review the trauma PI form that you filled out. Here's an example of how this form could be completed. This covers the first 8 trauma indicators. Does it match yours? Here are the next 8 trauma indicators. How does this compare to your form? Here's an example of the PI issues found after reviewing the records. Is this what you found too? Always review cases carefully and make sure that your corresponding trauma PI review forms are filled out completely. Thank you for participating in the activity. Let's return to why we do performance improvement in the first place. It allows us to improve patient care. This can be done by development of a strategic plan for trauma care, obtaining resources for the facility, guiding education and outreach efforts, guiding injury prevention efforts, assessment of provider, nurse, and EMT competency, and showing the effectiveness of clinical protocols and guidelines. Developing a strategic trauma plan based on continually monitoring and making efforts to improve care can be very powerful. There is great benefit to obtaining buy-in from EMS, hospital staff, and medical providers who participate in trauma care to develop an overriding plan on how care is provided for the seriously injured patient. Those who participate in the care need to be given an opportunity to participate in the plan development and evaluation. The trauma plan should be driven and validated by the Trauma PI program. Use what you find in your PI monitoring to guide what education is offered and delivered. Use it to determine staff education, outreach, and injury prevention priorities. Seek out educational offerings or provide in-house education. Consider routine competency evaluation, especially for low volume, high-risk procedures, equipment, and care modalities. Lastly, clinical protocols and guidelines are a byproduct of productive performance improvement. It decreases variation and errors and increases positive patient outcomes. They all need to be evidence-based, and they ensure all care is contemporary and consistent between providers. Remember to monitor after implementation of any PI action plans to determine effectiveness.